I'm Jamie from Kinetic Balance Fitness, and today I want to talk to you about posture and opening up our upper back and spine, our thoracic spine, so that we can have better posture, improve the way our shoulders and our body sits and moves to help you feel your best on a day-to-day basis. Now, in order for us to improve our extension of our thoracic spine, we get very tight through here, and that includes the spine as well as the rib cage. So one great place to start is actually in rotation to open up the ribs, open up the upper back and spine. So I'm going to teach you a thoracic mobility exercise that's dynamic, so it's movement that helps you open up the rib cage as well as gain mobility through the upper back so that we can hopefully lead to extension and sit you up taller on a day-to-day basis, reducing upper back and neck pain, shoulder pain, and just helping you feel better, move better, and get stronger. So there's several modifications. The baseline is going to be sitting back on your knees, but I'm going to provide you a modification if this is a challenge for you due to knee mobility. What we're going to do is we're going to place one hand on the floor or one elbow on the floor in a straight line. The other arm is going to go up to the opposite shoulder blade or behind the head. So we're going to start down low and we're going to inhale in through the nose, expand the belly, expand the ribs, and then exhale and rotate up towards the ceiling. So in this position, our hips and our lumbar spine and our pelvis, as long as we keep those hips back on those heels, are in a locked position. And as long as we exhale as we open with the goal of getting 180 degrees. And you can see, even though I have a lot of mobility in my spine, I fall a little bit short. And that's okay. It's just something that I need to work on and practice opening myself, right? But tie it in with that breathing. Now, there are several options to progress this. A progression would be sliding that elbow in between the knees to pin it down, and then opening up this way, and you get an even deeper stretch on that bottom side, really opening and exhaling as you open up. So this kind of pins the elbow down. But again, if mobility is a challenge at those knees, you can come into a quadruped position. We want to flex the feet and push back through those toes so that we pin down and close the SI joint here. And then again, we're going to open and rotate. So hand to the back of the head kind of holds the shoulder blade in position so that we can rotate and make sure that we're tying this in with our breathing. So inhale, and then on the exhale, we open and then relax back down. Inhale, feeling for that expansion of the lungs. And one last modification would be using something like a bench or a chair for support if kneeling is hard for those knees. But again, we want to be in a bent position here. We want to try to keep the lower, the pelvis and the lumbar spine as stable as possible, and then really practicing that rotation and opening up. So this is what I do at Kinetic Balance Fitness. I'm always trying to meet you where you are, give you mobilizations that work for your body, right, where it's at in your journey today. So modifications are meant to help you personally to get your mobility into a better position so we can move better, feel better, and reach our health and wellness goals. So let me know what you think if you give it a try. Open up those ribs, that thoracic spine, and feel better in your posture today.